Started. So my name is Casey Smith. I am a pediatric ER nurse and community associate at Trusted Health. I have with me today Nicole. She is our head of community marketing. I have Kelly George from the Wilderness Medical Society, and as well as our lovely host who I'll introduce in just a few minutes. About Trusted, if you're not familiar, Trusted is a place for the modern nurse. Not only do we place nurses in travel assignments around the country, but we also have a wealth of career resources from events like today, awesome blog posts, podcasts, and even interviews. This week, we're so excited to partner with the Wilderness Medical Society to bring you Nursing in the Wild, a wilderness nursing event. The Wilderness Medical Society, if you're not familiar with them, they are the world's leading organization devoted to wilderness medical challenges. And you'll have an opportunity to learn more about them in just a few minutes. Next slide, Nicole. She's my Vanna White. All right, so thank you again for joining us. Tonight's an opportunity for you to check out the Wilderness Medical Society, to listen, learn, and connect, and also explore your own wilderness nursing opportunities. A few other things, I've already mentioned it. Please stay muted unless you want to be heard. We have three amazing speakers tonight who you will meet momentarily. There will be a Q&A for each speaker, so if you want to go ahead and throw your questions for them in the Zoom chat, I will actually go through the Zoom chat and ask those questions out loud for our speakers. Since we do have a pretty large group today, I am not going to be able to hit every single question, but I'll do my best. But it's still helpful for us to see your questions to know, what you'd like to learn more about in the future and what maybe we missed in this presentation. Also, speaking to that, we will do a post-event survey. I'll talk about it again at the end, but if there's any topic or anything that we feel like you'd like to learn more about, please let us know. And also just let us know how the event went overall. We take that information really seriously, and it helps us just do a better job next time. All right, so let's talk agenda. We are going to talk about Wilderness Nursing and Wilderness Medical Society with Ms. Linda Laskowski-Jones, credentials and certifications with Megan Cassidy, and the future of wilderness nursing with Jason Muse. And without further ado, I'd love to introduce you to our first host, Ms. Linda Laskowski-Jones. All right, Linda, I'm gonna let you take it away.
Okay, Casey, thank you so much for the opportunity to be here. I couldn't actually be in Shenandoah National Park tonight, so I decided to at least put a virtual background up. So I'm kind of in that wilderness mood. My background spans about 37 years in nursing. I have been in the emergency and trauma field the whole time. I started out in the trauma ICU as a staff nurse at Baltimore Shock Trauma, then worked emergency services as a frontline staff nurse in Baltimore, came up to Delaware, got my master's degree, married my husband, with actually working 3 jobs, the ER, in an ICU, and I was doing 3 part-time jobs, but it was sort of a combined full-time, and some drug and alcohol detox thrown in because they needed people. And took a job as a critical care instructor, wound up working through a few years in that, and then became a clinical nurse specialist, trauma coordinator, trauma program manager, did that for about 12 years. Then I got a call from the CNO saying, how would you like to be the director of the emergency department? And I'm thinking, well, I don't know why I would want to do that, but because I'm a clinical person, but I wound up taking over a very large ED, creating an aeromedical program and ground ambulance program, and also taking over an observation unit along with keeping the trauma program. That expanded over the last 10 to 15 years to include ultimately 2 trauma centers, 3 emergency departments. We built a freestanding ED, and it was a super rewarding career. And I left Christiana Care about a year ago, which is where I was for 32 years after coming up from Baltimore. And then also now I'm the editor-in-chief of Nursing 2020 journal. I've actually been in the editor-in-chief role since 2009, but the role's expanded a bit, and it is my primary role, although I still do other things, trauma center consulting, and work with the Advanced Practice Registered Nurse Committee with the Board of Nursing, and I'm the state chair of the Delaware Trauma Quality Committee. Now, that's the professional background. The personal background, and let me just say that this has been interwoven through everything I've done. I am an outdoors person, and If you would go to the next slide, please. I can sort of tell you about some of these in some pictures. I learned that in the emergency and trauma field, whether you are a frontline nurse or in even other fields within nursing, nurses heal the sick and injured, and nature heals nurses. So, you know, burnout is very common all the way through the nursing profession, not just in those who are emergency care workers. And I found very early on that my refuge was outside. So a few things. I started actually backpacking as a teenager, you know, as the Girl Scout and did the camping trips, but my friends were backpacking and I made all the wrong moves and made all the mistakes. But I found I loved it and I wanted to go back. And then that evolved to, I'm going to try skiing, and I loved skiing. So skiing was the winter sport, and then backpacking or hiking was the summer sport, and fall, of course, spring, fall. And then I went on to realizing that I liked skiing so much that when I got married, I joined the National Ski Patrol with my husband, because he was a patroller. And I've been on the ski patrol now. It'll be 32 years this year, continuously. And I ski at Blue Mountain Ski Area in the Poconos. And somehow in all of this, I wound up connecting with the Wilderness Medical Society through a conference where I needed continuing nursing education. And I found that, you know, with a ski patrol background, and I'm also an EMT, I did ambulance work, and I also spent a few years as a flight nurse somewhere in all of that, that the skills that were being taught by the Wilderness Medical Society really complementary to my interests. And it was a more formalized way of learning how to improvise equipment when you're in areas where you don't necessarily have what you need, especially if you're like on a hiking trip and someone gets injured and, you know, you've got the contents of your backpack. So how do you manage that? So you can, next slide, please. Here are some pictures from journeys along the way. The top, of course, is from the ski patrol. And the neat thing about the ski patrol is, you know, you're in an outdoor environment. The weather can be anything. It can be, you know, the beautiful bluebird, you know, perfect ski day, or you could have, you know, driving snow, high wind, rain, ice, and we're in Pennsylvania, so that means anything is possible. So you do learn how to improvise because people do go off the trail, and the patrol has been part of rescues that have been in the area because the Appalachian Trail runs right behind us. And I know my husband participated several years ago in a hang glider rescue off of the Appalachian Trail. They came to the ski patrol. So everybody, you know, kind of pitches in, and whether it's a search or whether it's something on the trail itself, you get those wilderness skills. I also found that through hiking, which is a super great passion, and you can do short or long trips. You don't have to do a really long trip. You learn a lot about the history of the area. And so we try to hike somewhere wherever we go. So my trauma consulting has taken me all over the country over the years. And I always carve out at least one extra day to go and find a park, find, you know, woods, some trail system, and go out and discover it. And it kind of grounds me and makes me feel reconnected. And I learn a lot. And then there was the saying, I swapped spit with a wolf. Well, so part of this adventure is I connected actually through the American Trauma Society with a woman who was a volunteer at a wolf refuge. And I've always loved pictures of wolves. And I thought it would be really cool to like actually go to a wolf refuge. Well, not only did I go, I went in. And I had the up close and personal experience that most people don't get. So these are amazing animals. And we wound up supporting, you know, financially that wolf refuge so that, you know, they can continue their mission and their purpose. But I have some pretty amazing pictures, and yes, I swap spit with a wolf. And in fact, at one point, one of the wolves had his mouth around my head. It was being loving actually, and it just sort of made little indentations. So that was the reason for one of my tetanus shots. But can you imagine going into employee health and saying, I need to be updated on my tetanus? And they asked, why did you get hurt? Well, a wolf's mouth was around my head. So there was that. And then kayaking is something that I started doing probably, I guess, in the 90s. And I love to kayak. And I'm talking primarily flat water, although I have done some river kayaking. And had my share of flips over and all of that. So, but the flat water is very relaxing. We do kayak rescue patrol work for some of the local triathlons and opportunities to basically be out there. We do the triathlon, then we go, tour around whatever body of water we're in. So all of these places are places where, you can use wilderness medicine skills. Next slide. And that sort of brings me to what is wilderness nursing. So short and sweet, wilderness nursing is just what's on the slide here. It's knowing how to provide care in a wilderness, a remote, or an austere environment where you don't necessarily have access to your traditional healthcare resources and techniques. So all of these are unavailable to you. The other thing that I've done a lot of is event medicine work, and have written a book chapter on it and some articles. So you are the nurse going in, and you're working a triathlon, but it's in the mountains, or it's one of the adventure races in the mountains, where wherever the person happens to be injured, there's a challenge in extricating that person, from where they are back to traditional medical care. Even if traditional medical care isn't that far, say by an ambulance ride, you may be with that person for a while, during that rescue. So that's also work that I've enjoyed, and that absolutely is wilderness nursing. Next slide. So you can apply the skills that you learn in wilderness nursing, and it is actually wilderness medicine. Wilderness nursing is part of that whole sort of umbrella term when you do disaster aid work. So if your plan is to go in and help wherever the disaster happens to be, whether it's in your own country or whether it is abroad, or it could be in a developing country, and you may not have the resources, so you have to learn to improvise. The adventure race coverage or other outdoor types of events. You could be an expedition medical team member, depending on the length of the mission, where the mission is heading and the need for medical support. You could be one of the nurses who's accompanying that team. You could be a medical team member of a marathon, or it doesn't necessarily have to be only in an outdoor or austere environment. Yes, an outdoor environment, but an austere environment. And anytime that you're lacking resources, and that could even be a community-wide disaster. So what you gain, whether or not you do any of those things, is you at least learn the knowledge, the skills, the abilities to care for yourself or for members of your party if that immediate care is delayed or it's unavailable. So imagine being cut off from everything. Maybe you're driving a car and the car is stuck in a snowbank in a remote part of the country. You may have to survive in that car for a while. How would you do that? Or what if someone is sick or is injured that you're attending to in that type of environment? How would you manage that? Nursing school doesn't teach you those things. You need to actually go through a regular formalized curriculum to learn about those priorities. Next slide. So the Wilderness Medical Society is a 501c3 nonprofit organization that was founded in 1983. And you can see the mission. I'm not going to read the whole mission statement there, but mainly it conducts activities that foster the scientific knowledge of wilderness medicine. So a lot of people can do a lot of things that, you know, may, like for instance, like, you know, the cut and suck method for snake bite. That's not how you treat snake bite, by the way. Well, what the Wilderness Medical Society will do is to study what are the effective treatments if you're in a field environment. And they will actually work on establishing that science behind it. So they do public education. They have all manner of activities. The membership is interdisciplinary. So you go in, it's first name. There are doctors, there are nurses, there are pharmacists, EMTs, paramedics, people from all walks of life, because everyone is bringing that common passion with them. And one thing I found about the Wilderness Medical Society is it allowed me to combine my profession, which was the emergency trauma field, with my passion, which was being outside. And it really sort of freed me in so many ways to think differently about common things. And it gave me a lot of confidence in the ability to handle some pretty crazy situations. And I have used the skills I've learned when I've been camping, when we've encountered lost children in the wilderness and several other situations, some really deep cuts with a lot of bleeding and all that. So there's a scientific journal, there's a magazine, there's adventure opportunities, networking, research and grants, training and funding, and there's also wilderness credentials, which I believe Megan is going to be going over in a little while. Okay. So my advice before we pass it on to Megan is it's important to follow your dreams, and because they're telling you what you want to do, and there's always these barriers that we keep sort of hidden within us, but we have to try those things. We have to follow our dreams. Trying new things without sort of fearing that you're going to fail. You won't know if you don't like it until you try it. And don't let challenges be barriers. Some things are tough. Like learning to ski was very tough. I spent several years really learning to ski, but it's worth it. And then there's that joy that comes with it. And you know, pay attention to your intuition. And that's really important for situational awareness whenever you're outside or wherever you're anywhere. So if you get that niggling feeling like, you know, I should not do this, and it's really strong, pay attention to that. And also for the good things, like I need to try this, and maybe you should do it. Thank you very much.
All right, guys, we have time for just one or two questions right now, if you have any. If not, we can move on to the next speaker, but if you want to just throw them in the chat and we'll ask away. Jory asked, how long did it take to get your FAWN? Is it
actually, sure.
Same, FAWN? Yeah.
FAWM, yeah, FAWM medicine. So it took about 5 years, but that was at a time when the Wilderness Medical Society, I started it in 2005, finished it in 2010. The Wilderness Medical Society hadn't created what they have today, which was this calculator which showed you exactly where you needed credits and in which areas. So I didn't have enough credits in certain areas, and the calculator today would have probably cut a year off of my my time to get the FAWM. And it was actually a really fun journey in doing that. Took advanced wilderness life support and, you know, traveled to some conferences, and I even went to Scotland. And now the travel in that case isn't required, but that was also what I wanted to do. And it was a really cool journey to learn.
Awesome. Well, we have a lot of questions. I'm sorry, guys, we're not gonna be able to make it to, through all of them, but I like this one. What is one tool you always bring in your pack just in case?
So I believe in the 10 essentials. So I always have a knife. Always have a knife. And, you know, I think you can do a lot with a knife. It's protection. It's, so many different things. You can help make a shelter. But of course, you know, food and water and shelter, you need water more than you need food. But the knife is an essential tool. That's it.
Okay, perfect. Just for the sake of time, we're going to move on to our next speaker, but we can go back through these questions and see if we can hit them at the end. So I'm super excited to introduce you to Megan Cassidy. Megan, if you want to take it away.
Hey, Casey, how's my sound doing?
You sound fantastic.
Sound lovely. Thank you. That's what you're going to say. So my name is Megan Cassidy, and I have been a nurse for a total of 8 years and a travel nurse for 4 of those 8. It definitely took me a few years at permanent nursing positions to discover that I prefer consistently being on the road, and I like working at different hospitals and clinics around the country. I have experience in many different specialties, which has actually been very helpful for my career. So initially I was just not sure what I wanted to do, so I did a lot of things, and it ended up working out for me. I discovered gastroenterology in 2017, and I have been a GI nurse ever since then. However, this current year, I've been working COVID triage positions for the last few months. Having to adapt quickly, I think, and consistently learning and demonstrating new skills and performing at a highly independent, often with limited resources types of positions, I think are the skills that transition very well to the practice of wilderness medicine. You could advance slide, please. So I've always been super active as Linda there in sports and outdoor recreation, lots of travel, lots of adventure, but I didn't know how to combine all of these things together with my nursing practice. And I was actually doing an internet search in 2016, and I stumbled upon the WMS, the Wilderness Medical Society, read through it, and was so excited that having realized that there actually was a way that I could combine you know, passions, interests, things that I love to do in the outdoors, and actually apply that with my love of nursing. So I can definitely say that joining the WMS has been one of the best decisions that I have done, both personally and for my professional life. So for today, I will be giving a brief discussion on certifications and education within wilderness medicine. So I'm sure out there are experienced and advanced practice nurses. There's probably a lot of new grads, very happy you're here, and other medical and non-medical professionals in attendance. So while I will be speaking mainly from an experienced nurse perspective, please understand there is opportunity for all kinds of medical and non-medical professions. So as we begin, I just wanted to offer a few personal thoughts regarding wilderness medicine here. The first I want to say is that this is definitely a mindset as much as it is a skill set, okay? Secondly, don't be afraid to go outside your comfort zone, like Linda said, because this is going to happen all the time, and you got to be comfortable with that. Also, the journey is going to be the reward with wilderness medicine. There is absolutely no need to rush from A to Z in 2 days, okay? That reward is going to come with everything that you're going to learn. And lastly, addressing, I think, a couple questions I saw in the chat, is that you do not need to be a seasoned ICU, emergency room, emergency medicine, or OR nurse to be in wilderness medicine. So some positions are definitely going to require this, but many just want you to have wilderness medicine knowledge, some baseline experience, and definitely a willingness to learn and adapt. You can advance the slide. So here are a few industry recognized certifications and some education that is offered by the Wilderness Medical Society. And these are all certifications. They're recognized in the industry, and they are for the advancement of wilderness medicine. All of these are going to include lots of practical hands-on in the outdoors, as well as lectures and other components. So the first certification we have here is the Diploma in Mountain Medicine. This is also known as DIM. And this is an internationally recognized course. It's been around for over 20 years, and it's going to train you in the caring and rescuing of patients, specifically in a technical mountain environment. And you're going to have about 2 to 3 years to be able to complete that program. The second one we have here is actually rather new to wilderness medicine. This is the Diploma in Diving and Marine Medicine. It's also known as DIDM. And here you're going to learn care for patients in marine environment. It's like specialized training for diving physics, physiology, diving medicine, water rescue, and things like that. Super exciting. You also have about 2 to 3 years to complete this as well. And the final certification we have here is the Fellowship of the Academy of Wilderness Medicine, also known as FAWM. And both Linda has this, Jason you'll hear from has one, and I am currently a candidate in process. This is a well-respected certification. You have to be a society member to join. And you're going to complete pre-established lessons from a curriculum, and it's going to be composed of learning and demonstration for advanced practice wilderness medicine. So this is super fantastic, very prestigious. And if you actually apply for this program by the end of this year in 2020, you'll get 6 years as opposed to 5 to complete it because of the current COVID situation. And you can advance. Next here we have, I wanted to talk about 2 other certifications. They're not offered by WMS, but they're offered by other organizations out in the community, and you can acquire them everywhere. So our first is the Wilderness First Responder, or WFR certification. This is offered through NOLS. This does not require any medical background, and it is not industry regulated, but it does have a scope of practice guidelines. So this is an intro course on assessing and stabilizing patients in an outdoor setting. It's about 80 hours for the course, which is like 8 to 9 days, and you're going to do a lot of hands-on in the field, lecture, and mock scenarios. The second certification here is the Advanced Wilderness Life Support, AWLS, and this is accredited by the University of Washington School of Medicine. And this is for licensed medical providers, okay? You're gonna be learning treatment of injury and illness in the backcountry, and you need to retake this every 4 years. For currently licensed providers who are listening right now, I would probably recommend starting with the AWLS because you already have a medical background and it's more advanced than the WFR. But the WFR is also a great cert to have. And if you're not sure about wilderness medicine, it's probably a really good one to jump in on. And just of note, both of these certs, you can train to become an instructor for both of those courses. So that's another great way to build up your resume. So what opportunities are out there and where can I gain wilderness medicine experience? And how can I do what I enjoy and combine it with my nursing practice? So I just wanted to put together a little slide here that gives, and Linda had mentioned some of these previously, these are some ideas and pathways where you can actually jump right in to gaining wilderness medicine experience. And while this is not an exhaustive list, there's lots of other ways to do this. This is a great way to start building your resume. And please note that there are lots of opportunities for new grads on here. I kind of noted some of these that you can jump right in as a new graduate. And while I'm not going to go over all of these for time, I will mention a few. Linda did mention the ultra adventure races. You can do that as a volunteer. Those are awesome. Charity challenges and dream challenges are very common. You can get in on those. Search and rescue. A lot of local areas have a search and rescue team. You can inquire about what you need to get involved there. Research and grants. Super awesome. WMS has lots of grants and lots of support in that capacity. And maybe an outdoor rec guide doing like whitewater rafting or ski patrol. And one thing I did want to note here is that while there are many organizations around the world that do offer work for nurses in a wilderness medicine capacity, be aware that many of these organizations outside North America, for reasons of licensure guidelines, cannot accept North American or Canadian nurses. So it's a little bit of a tricky situation with the licensure deal. So just be sure you read the fine print before you start pursuing an organization. And you can advance, please. So little advice and tips here. I definitely wanted to be very clear in my presentation that there is no right way to gain wilderness medicine experience, okay? This is super organic. It should be super fun, and you create your own path in wilderness medicine. The second thing is definitely network. You definitely want to be talking to people and showing your interests, and that's how opportunities are going to happen for you. Definitely go outside and seek mentors. The wilderness medicine community is super supportive and super tight knit, and everybody involved is really going to want you to succeed. Very important to keep up to date on research, sign up for newsletters, listen to podcasts, go to conferences, be aware of what's going on in the industry and what the current guidelines are. And there's tons of free resources out there as well. And most importantly, if you take anything from my presentation, please never eat yellow snow. Thank you very much.
Megan, that was awesome. Thank you so much for that. If we have any questions for Megan, while we're waiting for some more questions to come in, there was one that I saw and I'm scrolling through. How do you connect yourself with medical expedition companies?
Connecting yourself with those types of companies, a lot of that is going to, I mean, there's stuff online that you can go, you know, look up different types of organizations. But I really think your best bet with this kind of thing is to get involved with an organization. And, you know, I will pitch WMS because it is the North American authority on that. But to start getting involved with organizations and with other people who are also in wilderness medicine, because a lot of this is going to come from talking to somebody and networking with people where you state your interest and then someone says, oh, hey, I know so-and-so, they're looking for this person, or here's their email, why don't you get in contact with them? So a lot of this is going to come from kind of being in that wilderness medicine community. So if you're a person who's a little bit more on the outside of that, you're going to have to jump in a little bit, you know, outside your comfort level and start talking to other like-minded wilderness medicine people. Okay. That would be, I'm sure there's a lot of ways to do it, but that would be my immediate answer to that. I don't know if Linda or Jason wanted to pitch in on that. And Linda, you're muted.
Let me unmute. I think you have to be really careful who you connect with. So I totally agree with you, Megan. Going with a group like WMS connects you to legitimate groups, because the last thing you would want to do is be a healthcare provider on a journey where maybe they're not giving you the resources that you need, and it's something that is just impossible. And people have found themselves in some pretty bad situations. So I have a trust through that society, and you network with others and you find out which are the trusted organizations where you know they're going to take care of you as well, and you know, stand behind you and help you through whatever situation you encounter, if it's you know, a wilderness encounter, whether it's through external medical control, you know, advice, or even sometimes, you know, getting you out of there, getting evacuation resources in to evacuate the patient.
Perfect. Thanks, Linda. Megan, let's see, any podcasts that you recommend? I know you mentioned some wilderness.
I actually listen to a lot of tactical medicine podcasts. I'm going to pitch the OPCOM committee that is on through the Wilderness Medical Society, and those are active military and civilian, combining wilderness medicine and military tactical care, combat care together. So I actually listen to a variety of tactical that I've found have been super helpful. I actually cannot off the top of my head, I'd have to go grab my phone to see the ones that I listen to. But if you type in like military or tactical medicine for podcasts, there's a variety. And actually there's a couple that I have that I actually would like to share with the group. So I will find that, Casey, before the end of this, and I will let you guys know.
Yeah, you can just pop it into Zoom.
Yeah, I'll pop it into the chat, you guys. Okay, thank you for that question.
Yeah, it's awesome. All right, guys, let's go ahead and take it on to the next host, Jason Muse. And Sequoia, I will answer your question in the chat because I was a travel nurse myself. So, all right, Jason, I'll let you take it away.
All right, everyone. So good afternoon. My name is Jason Muse. I'm a ER nurse by trade. I have my FAWM and my DIM. Also identify as a climber. So that's one of the big things that gets me outside the most. Then fun fact, once accidentally visited Norway. Definitely recommend it. So next slide. Okay, so quick disclaimer. So I am an active duty Army officer, and with that, I do need to say that the opinions and assertions expressed here today are mine and are not the official policy or position of the Army or Department of Defense, and I have no financial interest in this presentation. Next slide. Okay, so my journey. So really my journey in wilderness medicine started outside from a pretty young age. So I was in Boy Scouts, we have to do, outdoor first aid courses through the Boy Scouts. And so really got into hiking, backpacking, climbing, kayaking, kind of all the outdoor stuff when I was young. And then I joined the Army. I went to nursing school, did Army ROTC for 4 years, and then came on to active duty. I worked at Brooke Army Medical Center. It's a level 1 trauma center down in Texas, also has a burn center there. I was there for about 4 years, deployed to Afghanistan in 2014. Came home. I went up to the 2nd Stryker Brigade Combat Team up at Fort Lewis, Washington, which is where I'm stationed now. And that's kind of where my journey in wilderness medicine truly started when I reached out to Scott McIntosh, who is a wilderness medicine physician in Utah, and then Ian Wedmore, who is a now retired, but Army physician, emergency physician, and wilderness medicine doc. And they got me involved with WMS and really kind of started that journey on my FAWM and my DIM. And really, once I kind of put my toes in the water, it made sense because wilderness medicine and Army medicine are very much one and the same. So good quote for all my ER nurses out there: if you didn't get hurt, you aren't trying hard enough. So that's Jerry. That's that guy that comes in that was doing something stupid at the ski resort. I'm sure Linda's taking care of a few of those guys. So let's go to the next slide. So I'm Jerry once in a while. I like to take risks. I take a lot of risks in a lot of different places. And that's my selfish reason for wilderness medicine is how do I take care of me or somebody in my group if they get hurt. So like I said before, I climb, I ski, I dive, I paddle, horseback ride, you name it, sail. But with all those risks comes the training of my line of work. If you go to the next slide. And it's how do we mitigate that risk? So my job is very much risk mitigation at first. So we talk about wilderness medicine in different terms. We call it force health protection. So whether that's putting medical assets in the right place at the right time, having the right people there. So whether those are EMTs or nurses, I saw a couple of my battle buddies in the chat earlier, whether they're flight nurses or they're nurses on the ground or teaching. That's a big part of it too, is teaching, hey, here are the environmental risks and how do we mitigate that risk? All right, so here in my home state in Washington, I spend a lot of time at Mount Rainier National Park. So this photo was taken on Mount Rainier, looking south towards Mount Adams and Mount St. Helens. I think that's Mount Hood there on the far right. So in Mount Rainier National Park, we've had quite a few rescues this year and quite a few deaths, and that's very unfortunate. And what we're seeing is a massive uptick in the number of users of the outdoors. So COVID has really amplified that. So with a lot of things closed in the state of Washington and around the country, really the world, we're seeing a lot of folks heading outside and reconnecting with nature, but that's also leading to a greater strain on the very limited rescue resources we have in the United States. Go to the next slide. So talking about the future of wilderness nursing. So as it stands right now, we have this chain of survival in the event that you have an emergency in the wilderness, whether that's an injury or illness. So that starts with a first responder, right? And those are usually, whether those are medical personnel or non-medical personnel, the certification there would be the WWOOFer that Megan talked about earlier. So those could be bystanders, those could be guides, it could be a mountain rescue first responder or a ski patroller. But they usually will hand that patient off to a paramedic or EMT. And that's usually the mountain rescue ALS service or your county EMS service. And then they go on to the emergency department because wilderness medicine doesn't stop once you hit the hospital. I'm sure we've all seen some form of an illness or injury that was generated in the outdoors. And then forward on to rehabilitation and, in my view, kind of reconnecting with the wilderness. So to share kind of a personal story, so I was climbing a couple of years ago and I took a lead fall. So that's where you're climbing above the protection, and I fell and my belayer did not catch me, and I fell about 90 feet and stopped about 5 feet off the deck. My belayer was injured. He burned his hand because he was belaying incorrectly. And I would have been killed if I had not stopped. And so to me, I think another place for nurses in the wilderness is kind of working with folks who may have had a catastrophic injury or some kind of significant event in the outdoors and kind of helping them reconnect with that. So for me, it was a long process of getting back out into climbing and enjoying it again and not being scared that it was going to kill me. So that's definitely a place where I've identified a gap in wilderness medicine that I think nurses would be perfect to fill. So we'll go to the next slide. So really the future is now. I was doing some reading today on the history of nurse practitioners. Nurse practitioners have been around for over 50 years, and I didn't know that. And I think if you had talked to some doctors around the country in the 50s, they may not have known that either. So really for all you guys that are out there, new grads, experienced nurses, there are plenty of opportunities. Linda and Megan have both spoken to that. So flight nursing, occupational health nursing. So this is something that folks don't really think about, but oil rigs out in the middle of the Gulf or kind of remote work areas, they all have occupational health nurses. And those are part emergency nurse, part industrial hygiene nurse. And so they're doing a lot of that austere nursing, that wilderness nursing. And in those kind of environments, you will see environmental injuries. So you will see whether it be hypothermia or frostbite or severe sunburns, things like that. Education. So you have plenty of ways to prevent an accident, right? And so we call that PSAR, preventative search and rescue. And so that's just, we have organizations here in Washington that go out to trailheads and talk to folks and make sure that they're prepared to travel into the backcountry. A great example of that here is our backcountry ski patrollers will go out and talk to folks at popular trailheads and make sure that they have shovels and beacons and all the supplies, the 10 essentials that Linda mentioned, to have a successful day out in the wilderness. You can pursue your FAWM, you can pursue your DIM or your DIDM, and then they do have accelerated RN to EMTP programs. So this is a big issue I have found trying to get involved in wilderness medicine, is the fact that in the Army, my scope of practice was really dictated by the physicians that I work with. But in the civilian sector, that's different, right? So we have the Good Samaritan laws that will cover us in some situations, but not all. So it's sometimes, depending on the situation or the role you want to work in, paramedic license would be very helpful. I know Creighton University is one off the top of my head that you can do. I think it's about 6 weeks total of training, but you do your RN to EMT and then RN EMT to RN EMTP. And so that'll allow you to take that national exam to get your paramedic license and then start working with some of these mountain rescue ALS units or with your local fire department or sheriff's office that does the rescues in your area. So in the future, one of the things that am kind of working on and starting this grassroots movement now is pre-hospital registered nurse licensure. It exists in some states, but it is pretty limited to critical care transport. However, I think that with some legislation changes, we can make this license a little bit more inclusive for wilderness medicine and pre-hospital environments, which will help close the gap because we do have a big shortage of qualified rescue personnel right now. Part of that is folks not being aware of the opportunity, but part of that is rescue services having to turn down qualified volunteers because of licensure. So I know that here in Washington, the ALS Mountain Rescue Service won't take nurses because of licensure. You can be an EMT, you can be a nurse practitioner, you can be a PA, or you can be an MD, because all of those folks have licensure outside of the hospital, but nurses do not. And that'll take some collaborative efforts between the WMS and the ENA and the AANP and SOMA and all these other organizations. And that kind of brings me to a bit of a closing comment of, there's an old African proverb, if you want to go far, go together. If you want to go fast, go alone. So I kind of went fast for my first couple of years in wilderness nursing, and I got all these certifications, and then I hit a brick wall, and now I am building my network and working with all these other great nurses and physicians and paramedics and wilderness first responders to really help better wilderness medicine as a field across the board. So just kind of recapping, wilderness nursing is kind of, I view it as austere nursing. It covers humanitarian and disaster medicine. You know, there are tons of organizations you can get involved with there. Wilderness medicine, which is also care and research. So if you're into research and you don't really want to carry a 200-pound litter through the mountains for 2 days, you know, research is a way to contribute and to be involved. Occupational health nursing, you know, it's something that, to me at first, I've done it, you know, for a short stint, and I was like, God, this is going to be super boring, but it's actually really interesting, and there's a lot of opportunities there. And then there's flight nursing, and depending on where you are, a lot of those flight nurses do some hoist rescues. So, all right, next slide. Okay, so just advice. So don't wait for someone to write your life story. I think we've all really hit these 3 points here. You know, this is your journey, so you really need to go out and figure out, say, hey, what looks cool, right? You know, a lot of people, you know, climbing the Matterhorn behind me, you know, it doesn't look cool to a lot of people, but Swiftwater Rescue may, where you're rescuing folks out of flash floods or whitewater rapids. So if it looks cool, you go try it. There's a level, you know, in all disclosure, there's a level of things not being fun in a lot of wilderness environments, but the fun usually outweighs the bad parts. And then don't underestimate your own experience. And this is really for the new grads. So imposter syndrome is real. So I'm a pretty young nurse in the grand scheme of things. You know, I work in the ER with nurses that are, you know, my mother's age. And so sometimes I feel like I'm not qualified to be doing what I'm doing, but don't let that imposter syndrome stop you from trying something. You know, if anything, this is a testament to, if you go out, you get the training and you really put apply yourself, then you can do whatever you want, really. I mean, the wilderness is a big wide world, so go out there and get it. All right, questions.
All right, Jason. Thank you so much for that. That was amazing. There's one question I saw that I think a lot of people wanted answered. What is the best site or source, or what are some sources for finding jobs related to wilderness medicine that maybe is not kind of like right there in front of your face?
You said climbing jobs?
No, sorry, for finding jobs.
So I would say starting with, you know, start at your local sheriff's office. Your local sheriff's office, in the way the disaster and emergency management systems work in the United States, is sheriff's offices run search and rescue by and large. So that's a good place to start. Your volunteer fire department, if you're looking to go overseas, the Red Cross, the International Red Cross, is a good place to start. You've got Doctors Without Borders. Look for these big name, you know, well-recognized organizations, you know, legitimate services, because what you don't want to do is find that too good to be true opportunity, because there are a lot of issues with doing medicine overseas. There's a lot of legal issues with doing medicine in the United States. So, you know, we're all nurses here. We know that there's a legal peril everywhere you go. But having been, you know, stuck at customs trying to explain why I have a suitcase full of narcotics, you don't want to be with one of these small groups that you know is kind of just, you know, feeding you poor information and putting you in a hard spot. So I would say start with the big places, and then the WMS, you know, there's a member directory, and so reach out to folks. And like, I think Linda and Megan both said this, like network. Really find people you trust and reach out to those people, and they can help connect you to some of those smaller groups. There's a organization, a nonprofit that goes into Kurdistan in northern Iraq and does surgery and trauma care, and they teach medics there. And you know, that's a pretty unknown organization. And there's tons of those that are very legitimate, but they're small, and you're really going to find those through networking.
Can I make a quick comment, Casey, before we go? So the thing with wilderness medicine is it's not like how we're all trained to go, okay, I'm going to take my NCLEX, I'm going to go to nursing school, then where I did my rotations, I'm going to talk to somebody, they're going to hire me. It's not this clean cut, you know, everybody does it the same way type of scenario. And I think that that can be a little tricky for some people where it's like, well, is this a practice? Is this a certification I get? Is it a license? Like, what is it? And essentially, if you can kind of take what I think what this presentation has tried to give you is that wilderness medicine is its component and you apply it to your nursing practice. So there is no set path that you're actually, everybody's going to do it the same way. So your best bet is to get yourself submerged with people who are already in wilderness medicine, and things will start to become a lot more clear of the pathways that are there for you. So I just kind of wanted to pitch that out, that it's not a 1, 2, 3, 4 wham bam type of deal.
Yeah, that's a really great advice. You know, find someone who you think like what they're doing is really cool, and you know, ask them how they got there.
Yeah, definitely. I mean, to kind of follow up on that, you know, I really wanted to be a ski patroller, and I did all this training to go be a ski patroller. And I showed up to the ski patrol office and they said, but do you have outdoor emergency care, which is a totally separate certification? And I didn't, so I didn't patrol that season.
Perfect. Okay. This is going to be for you, Jason. Someone asked, I'm trying to find it, but how do you get involved in the military after you're already a nurse?
So after you're already a nurse, if you wanted to be involved in the military, is talk to one of the various services healthcare recruiters. So there's the normal Army recruiter in the strip mall that everybody knows and loves, and then we have healthcare recruiters, and these recruiters are geared towards recruiting nurses, doctors, dentists, physical therapists, and a slew of other specialties. And then I would say also look at each various service or find someone that's doing that and kind of talk to them, because we all have different specialties, right? So I saw another Army nurse in here, Courtney. She was a flight nurse on an Army helicopter. But we also have en-route critical care nurses in the Air Force that do CCAT flights. So they put an ICU in the back of a cargo plane and do that. The Navy has, their own specialties. So definitely, find someone that's already serving. If folks are interested, they can shoot me a message. I'll put my email in the chat, and I can get you guys connected.
Thanks so much. So this is going to be for each of you. We would love to hear lists from each speaker about top 5 to 10 essentials to carry when in the wilderness as a nurse. Try to keep it short and concise just due to time, but what are your top picks?
Do you want me to start? So for 5, adequate clothing. Okay, so that would include, warmth, a hat, even if you don't like hats, a compass and a map, so you know where you are. I mentioned the knife. I meant food and water would be my 5.
I'm going to say, actually, I had to write this down. So a little different, but I would do antiseptic wipes. I would do moleskin. I would do antihistamines and ibuprofen, and some bandages with that. And I always carry a tampon because it has a myriad of uses, people. It really does. Always carry a tampon. Right, Jason? Unmute yourself, Jason.
You're muted, Jason.
There we go. All right. So I always carry a way to purify water. So that's a big thing. I don't like carrying water. Usually in the Alpine, I'm carrying a rope and a trad rack and all kinds of other stuff. And so water is one of those things I don't want to carry as much of. So water purification, navigation is huge. So many rescues start when somebody gets lost because they couldn't get themselves unlost. And then a knife for sure, duct tape. I have duct tape on everything. It's on my Nalgene bottles, it's on my trekking poles, it's everywhere. Because you can use that for just about everything, right? And then food is kind of the last thing. For me, so layers is one of the 10 essentials, but doesn't make my top 5 because my, experience has been that if I keep moving, I'll stay warm to an extent, right? So I've also been on Mount Rainier when it's, total whiteout, nuking, and everybody's cold because there aren't enough layers. So that's my top 5.
Perfect. Thanks, guys.
throw a trash bag in there too, one large orange trash bag. And it's shelter, and it's clothing, it's rain gear, all of that. Just put a hole in it and pull it over your head, or make a hood out of it. And sorry,
Yeah.
I'd add the trash bag. It's simple.
That's awesome. Thank you for that, Linda. All right, let's see. So this is a great question. And I know, Linda, you probably can speak to this yourself. Do you need some sort of certification to get into the research aspect?
No. I think there are many people who don't really want to be outside, but they're fascinated by the research methods, and they want to participate in the analysis and or the writing, and all of that is very important. So I would say if you're interested in that, go for it.
The WMS has a lot of people involved in very important research, very skilled, and there's a lot of people in that society who will help you get a research project started. There's grants. I mean, it's, I definitely hope everybody's going to go check out WMS, because it really is a one-stop shop for everything.
Right. Awesome. Thank you, guys. Linda, Megan, Jason, you were wonderful. Thank you so much. Wilderness nursing is something that I was personally super interested in. So this presentation, I selfishly wanted to put this presentation together for myself. So thank you. I learned a ton. And I think I can speak for the rest of the nurses who joined us tonight. So thank you so much.
Thank you for having me. Thanks.
Oh, of course. A few things. We just have a list of resources on that last slide. I just wanted to point out that we will actually email those resources out to you guys after the presentation. This has been recorded, since I know it's a lot of information. So we'll send you the slides, the recording, those resources. And Megan actually has her own list of personal resources for wilderness medicine that I'm going to include in that email. So you guys are going to get a lot of information coming your way, so you can kind of do your own research and learn more about wilderness nursing and the Wilderness Medical Society. Also want to note that the Wilderness Medical Society has actually given us a discount code for our nurses who attended this event. It's WMSRN. It's on the slide, which you'll receive in the email, and you'll save 20% off your initial membership. So you can email Kelly at wms.org with any questions, but like I said, all of this information will be in that follow-up email. So that's pretty much it for tonight, guys. Thank you so much. Last thing I'm going to say is that please do that follow-up post-event survey and let us know how you liked it, what you liked, what we could do better, and what you want to learn next time. So thank you guys so much. Have a wonderful night, and hopefully we'll see you at the next one. Thanks, guys.